Yeah, hello everyone. Welcome to the Lunch and Learn series hosted by Community Campus Partnerships for Health. My name is Sharice Iglesias, and I'm the Training and Resource Director here at Community Campus Partnerships for Health. And I'm actually going to pass it off to our Spanish interpreters to give y'all some instructions for language. Okay. Let's fix that.
I could hear that.
Thank you everyone for your patience. We want to provide more language opportunities, but with trying new things, it comes with some hiccups. Annabelle, should I turn it off? Okay. Okay. Thank you. So one of our Spanish interpreters, Annabelle, said that the instructions will be in the chat for language use. Okay, and even English speakers, make sure you select English where that global icon is, just so y'all can hear me. Is there anything else that we should say, Annabelle? Okay, thank you everyone for your patience again. I'm going to share my screen. Emily and Alan, if you can let in folks, that would be great. Okay, thank you again for your patience. And again, welcome to our Lunch and Learn series. Today, we will talk about managing project wrap-up. It's part 2, where last month in October, we talked about managing project startup. Okay, let's get started. We're going to start with a poll just to get a feel for where people are, where you're coming from. So let me bring up the poll. Project wrap-up. Like I said, I just want to get a feel. Who's here? What do we already know? What's our familiarity, our comfort level with Project Wrap-Up? What is Project Wrap-Up? I see very few people are very familiar. More people are kind of familiar. Okay, looking good. I'll give y'all like 10 more seconds. Kind of familiar, not familiar. Okay. I'm going to end the poll here and share the results. Seems that most of us are just kind of familiar and not so familiar, which is, good. We're in a good place right now. We have some discussion questions and some key concepts and a breakout session so that we can become a little bit more familiar with what's going on. Okay, thank you for participating in that poll. So before we get started, I want to introduce Community Campus Partnerships for Health. For those who don't know, we are a small but mighty nonprofit that promotes health equity and social justice through partnerships between communities and academic institutions. And most of our work is led by these strategic pillars where we lead discussions on authentic and equitable community academic partnerships. We disseminate information and resources and manuscripts, and we also provide technical training such as this. And I just want to highlight one of our long-standing partnerships. It's been 7 years now with the University of California, University of North Carolina, Chapel Hill's Clinical Scholars Program, funded by the Robert Wood Johnson Foundation. For those who don't know, the Clinical Scholars is a wonderful community of clinicians that work with their local communities to co-conduct research on health disparities. And as part of our partnership, we provide technical expertise to help support them in their project goals. Okay, let's start with an icebreaker. Please, in the chat, like we said, we just want to get to know who's here and break some ice. Please include your name and your pronouns as well as your organization and affiliation. Again, we just want to know who's here. And while you do that, I'm just going to move on, but feel free to put your information in the chat and say hello. So today we're going to talk about some key terms: authentic partnerships, partnership agreements, project closure, as well as inclusive facilitation. And our learning outcomes for today are to review components of authentic partnerships and project closure agreements, list technical and logistical issues in project wrap-ups, and describe strategies to facilitate wrap-ups and maintain healthy, authentic partnerships. Okay, so those are our outcomes for today. Thank you all for introducing yourselves in the chat. Feel free to keep going, but I'm going to pass it on to my colleague, Dr. Alan Wells, who will lead us in a discussion of project wrap-up.
Hello, everyone. Thank you so much for coming today. I see all kinds of great people from all over the place. Is that Episcopal Health Charities in Houston, Texas? I think I see there. I see Claremont University, University of Chicago. This is all wonderful. Thank you for joining us today. We're just by way of review, let's look at some of the fundamental structures of a partnership before we discuss wrapping them up. So we work largely, as many of you do, from a partnership model. We would call this building an authentic partnership, and it goes through certain different processes. We look at the guiding principles of that partnership, such as inclusion and equity from the very beginning, as many of you do, quality processes, meaningful outcomes, and perhaps most importantly, transformative experiences, which can include an impact on the community of purpose with health outcomes, and also mentoring and sustaining that partnership itself. Next slide, please. So I think it's important to talk to all of you people who are leaders today, and I see all of you are from the community and from academic centers. And one thing that we all have in common when we're looking for funding for a health study is to look at the agreements that we have in place with our funding agency and the community partners. And these are very important because we're going to discuss ending them, so we should start them and discussing them in continuity from their beginning to their end. And most importantly, how do we plan accordingly a priori in the beginning of a project for the end? In this regard, the idea of backwards design becomes very important. And it's difficult when you're starting a project because you have so much energy, so much administrative minutia, small details on how to start up a partnership, that the ending of it is often lost in the shuffle. So I find that reviewing an agreement and some of the initial agreements will help us discuss the very end of them or the continuity of them. So we look at agreements that have common purpose, goals, and objectives. We articulate roles and responsibilities, perhaps even in an organizational chart that designates responsible decision-making. Very importantly, budget, resource sharing, payments to the community, copyright and ownership issues of materials and data, even copyrights of sometimes devices and materials, depending on your level of technical engagement with the National Institutes of Health, for example, or even a funding agency that will use an assessment tool in the long run. A dissemination plan. How do you talk to the community, the press, your administration, your respective boards about how you're going to generate information, distribute information? And then brings us to our discussion today. What are project wrap-up considerations? What do you do? It's best to just think about the end at the very beginning. Next slide, please. Project wrap-ups aim for these authentic partnerships in a way that they can be sustained and evolve during, between, and after a funded project timeline. Authentic community-based collaborations, as many of you know, because I see people from all over the country here, and you have a wealth of experience, and we will be spending the majority of our time today in a breakout session so you can discuss and cross-fertilize your ideas with each other, and hopefully come at the end of this session with some ideas that you have shared or gained from others working in the field. This is a practical approach to managing projects on the ground, if you will, more than per se an academic conversation about the principles that drive them. We look at these collaborations, they're built upon relationship, and these relationships involve higher values such as mutual trust, respect, and sharing. Next slide, please. So technical and logistic elements of project wrap-up have to do, of course, with communication. They have to do with legal documents because it involves your resources and your money and your sustainability. And then, of course, data or knowledge generated and the resources that are shared between the community partners, the community impacted, and the partnership at large, whether it be something like a large entity of the Episcopal Health Charities that continue to work in the community, whether it be a grassroots program, such as many of the people I see here today. Oh, I see someone from Medical College of Wisconsin. Hello, that's my alma mater. Next slide, please. Breaking these down slightly, again, in the protocol, establishing the ending up front. I know from Medical College of Wisconsin and many others with these state funding agencies, also with NIH, they have you look at the protocol of closing the project up front in your evaluation plan. A part of this is also keeping discussions open, checking in with your partnership, evaluating them concurrently and concomitantly together along the way, and looking towards the idea of ensuring a lasting impact on the community through this capacity building that is sustained. These elements you think about a priori in the beginning. Let's move on to the next area that we listed in the slide before. Next slide, please. Legal. Clarify the dissolution in bylaws. Commit in writing to the parameters of your project closure and dissolution. For example, in many cases, in my experience with community-based partnerships from the university side, we would love to have established regular discussions during and between the partnership itself, but also commit to regroup afterwards, commit to keep the relationship and channels open, commit to using your data that has been collected in the current project for sustaining, documenting, and justifying the next steps if you were to move forward with another project, if they were to build upon each other, so to speak. Next slide, please. Data and resources. I'm going to share the presentation now with my colleague from Philadelphia, Emily Finley, and we're going to do a small video of a data walk, which is just one strategy, and I'm sure you thought of many others, to include the community in looking at results and dissemination. So I hand it over to Emily, please. Thank you.
Thank you, Alan. Yeah, so I'm going to talk a little bit about the what you do with the data and resources that your project builds and accumulates and creates through the course of the partnership, and how you manage those data and resources at the end. So partnership projects may develop a whole host of assets and resources over time. So that can include data that's collected by the project, physical resources like equipment and technology, as well as research products like toolkits and interventions. So these are all included as products of the research. And so the end of the partnership, doesn't mean that all of these products or outcomes disappear. So for example, changes to policies, workflows, or service delivery that result from the research may be longer lasting outcomes. But since products of the research are property of the partnership, it's really important that partners agree on how to distribute and use resources at the end of the partnership, as well as how to attribute resources and give recognition for the work that's been done. So agreements around data usage can be set earlier on in the project. Who gets to use the data that's collected? How do they get to use the data that's collected? Where is it stored? All of these types of considerations. And so a data use agreement can be a helpful tool for deciding some of those considerations. As well as what happens to assets like equipment that's bought, technologies, things like this. And we know that community-based partners often are lower resourced than the academic partners. So if there's a way to shift ownership or make sure that the ownership is still being shared between the academic and community-based partner, that can ensure that the community-based partner has some enduring resources and capacity built as a result of the research. So next slide, please. So let's hear from you guys. We've talked about the importance of discussing closure of projects at the beginning of the partnership. So we'd love to hear from you about the value of that. And this can be complicated and feel kind of counterintuitive since there are so many considerations to be made just to get the project off the ground. But it is really important to, give some thought to closure discussion at the beginning, with the caveat that, things may change, new assets may be developed that, in the course of the project that you didn't anticipate, which is why it's also important to discuss closure as the project moves along, especially in community engaged projects, where you may have more shifts and changes to your protocols as you engage with community members, receive more community embedded feedback, and those types of things. So I'm seeing some comments coming into the chat, yay. Clear expectations and communication make a productive work environment, absolutely. Avoiding disagreements and conflict at the end, yeah, that's so important. It's really important to trust building. Yeah, avoid surprises at the end that could harm community and partner relationships. Exactly. Same vision on what parties hope to see at the end. Yeah, that's also very important. These are really fantastic. Provides transparency. about the end goal at the start and may increase trust at the beginning of the relationship. Yeah, transparency and to align on the mission and vision of the work. Wow, these are really excellent responses. So let's move on to the next slide. Great. So here are some practical tips and action steps that you can take as you close out a project to collect feedback and documentation to help you compile lessons learned that you can take with you into the future. So, you know, really important if you can to hold debrief sessions with lead community partners, the project team and leaders to hear what worked well and what did not. If this can be done, you know, either in person or virtually, you know, as a discussion, that can be a really productive kind of session. And if you can invite project participants as well, that's an added bonus to see how did participants feel about participating in the study. What is their feedback? And it's also important to record your successes and challenges throughout the program. And you may also send a feedback survey to community partners, you know, to get additional feedback from them. And this can be really important to planning future projects within the same partnership, you know, and having sustainability in that partnership. Next slide, please. So as Alan mentioned, we do have a short video on a data walk. So a data walk is just an example of a method of participatory dissemination of your data and research outcomes that you can do at the conclusion or closeout of a project to share your results and outcomes directly with community members. And this is important because oftentimes academic research gets reported in journals and other forums that aren't necessarily accessible to community members. And so hosting more participatory dissemination sessions is really important to sharing the products and resources of the research with the community. So we can show this short video, please.
We call this the data equity walk. We think it's important, once again, that we engage in the data. We know that data doesn't tell the complete story. We know that there's context to the data that you see. We want you to go and do a gallery walk and answer some of the questions that you see. Number one, what is the general reaction that you get from the data? How does the data strike? What's the story behind the data? How does this connect to your personal experience? What further information would be helpful? And what solutions do you think can happen to address these issues?
Okay, thank you. Oh, there's a request to add the link to the video in the chat. Cool. And we got that. We can go to the next slide, please. Great. And so this is, you know, a few ways to thank your partners. So recognition and attribution of work completed is really an essential part of ending a project. So often community partner contributions maybe get footnoted, and acknowledgements and accolades are given more to academic and institutional partners. But it's here are some ways that you can thank all of your partners and also acknowledge them for their contributions. If you can, you know, create a compilation video with photos from local events, if you've been doing any kind of documentation of your activities, that can be put together into a fun presentation. Celebrations that bring local partners and teams together to acknowledge accomplishments. So, you know, even just hosting a dinner, a little reception, you know, giving out certificates and awards to people who had outstanding contributions, sharing stories about the positive impact of the program can be really powerful. So not just the data in numbers, but the story that the data tells. And, you know, also invite local political leaders to give more attention to the role of community partners. Make sure that, you know, those in power, you know, whether they be political leaders or institutional leaders, hospital leaders, you know, healthcare system leaders, you know, are aware of the community partners on the ground and the contributions that they've made. So we can go to the next slide. So we are going to work in breakouts for 15 minutes. We ask that you share lessons learned, stories of experiences with project wrap-ups that you have worked with. Or if you know, are just embarking on a project wrap up or starting to think about that or planning it at the beginning of the project. If you want to share questions or potential strategies as well. And then we just ask that each group assign a report back representative. So we're not able to facilitate all the groups. So please assign a representative to report back at the end and we'll share out before we wrap up.
Okay, I'll put everyone in breakout rooms now. Thank you.
So I want to remind you to select your language by clicking the interpretation button. Select English or Spanish to make sure that we can all hear. And yeah, would anyone like to volunteer to share some key takeaways from your breakout discussions?
Start.
Sure.
So with our breakout, my name is Tosi, by the way, Tosi Denny Miller, and I'm here from Center for Black Women's Wellness in Atlanta. Some key takeaways for us is the wrapping up of research research, I guess, administered with the community is listening sessions are really, really great. So oftentimes we'll work with funders, and at the end of like a grant cycle, they'll host a listening session for all of those in the community that were in the grant or a part of the grant to hear challenges, wins, what the future state looks like for grant funding, because that is a huge gap of like, hey, what's going to come next? So listening sessions. And then we also had someone in our group talk about like a one-page digestible report that either, I think it's the funders or the community would make to then disseminate to policy and advocacy sources. So basically, if you want to help the community, this is the research that was done, and these are next steps on how you can help them.
That's fantastic. Thank you so much for sharing that, Tosi. Listening sessions and one-page summaries, yes. We love research summaries that are accessible to our community members and participants. Would anyone else like to share?
Tosi, can you say a little bit more just like about how you delivered those listening sessions?
Sure. So me being the community part of it, I didn't actually administer them. I went to the listening sessions, but I guess how that happens is literally you just bring everyone into the same room, and usually the funder or the person hosting the listening session would have an agenda of like, hey, we want to hear how this grant process went for you. What were you able to do with the funding? Were there any wins that you had, any losses? And then obviously just taking notes on everything for takeaways for the funder. But also, I think it gives the community an opportunity to have kind of like a nice bow on top of all the work that you've been doing. You feel like your voice is heard as well. And then also, I love going to listening sessions to hear next steps. And I always make sure I ask, okay, so what's next? Is there anything next?
Thank you. Anyone else?
I can. This is Maggie Hawkins, and I'm with Claremont Graduate University. And I was working, it was just Kim from Detroit and myself. And actually, I thought we had some unique perspectives because Kim just came out of working for a long term with General Motors and working with community engagement there, which, to be honest with you, I wasn't even aware that General Motors was doing that much. So it was really refreshing to hear that. Probably the biggest thing was to be open, honest. And I think they mentioned earlier about listen, like really listen to the community when we're working together. Engaging community as part of a team. I think we've kind of hit on that. I was realizing I am presently working with a community organizing class where we have community partners, and I'm realizing that I would like to see us be a lot more intentional. We do an MOU with them, but the students just do a very short project with our partners, and so I would really like to look at how do we expand that. And then the other thing that both Kim and I talked about was just making the results having results and then really making them accessible to the community. And I think that was mentioned earlier too. Thank you.
Thank you. We have time, I think, for another share out.
I can share our team.
Yeah.
We didn't talk as much about what we've done, but we were really excited about what we're going to do for future closeouts. We love the idea of the data walk, to be able to share with the communities the data and get their feedback and their thoughts about that. And also the opportunity to ask them, like, how would you like to be involved in our community work in the future? Was key moments for collecting data and feedback that we thought that we could capitalize on for the next time. So we were very excited about what's being shared with us at this training.
Thank you. Yeah, a theme that I'm hearing is sharing out your data in an accessible way, but also planning for the future. And so using that time, to also do that planning. Yeah.
We had a really good discussion about clarifying people's upfront or costs that we didn't think about before that have come up for, especially from the nonprofit side and the community side, such as funding requirements for compliance, such as audits and things like that, that many people don't think about, but it was a burden to the community groups to keep people working, whereas the funders have more consistency. We also mentioned that one good rule of thumb when preparing partnerships is to look at giving an advantage financially to the community partners. And this is a part of preparing your institution if you're working for a philanthropy or a university, to share the wealth, if you will, very intentionally. Thank you.
We have time for one more share out. Anyone is interested?
There, in our group, we also talked about not having seen this being done really in an intentional way in many projects, where you get to the end and you're short on budget, you're short on time, and it's kind of easy for this to fall by the wayside. So just trying to be more intentional about that, and also checking in with our own teams and with community members to reflect on what went well and areas for improvement in future partnerships. We talked about, especially in places where like one person kind of is responsible for community relationships more generally, like making sure that you're checking in and being accountable to those community members is really important, sort of like as a good ethical practice, but also to ensure that you can continue doing that work in the long run. So it is worth trying to plan for that ahead of time and being intentional.
Yeah, thank you, Katie. That's a great point. Having assigned staff roles that are involved in community engagement and building that into a workflow so that it doesn't, go by the wayside, so that it doesn't get overlooked is really important. So with that, thank you so much. Every time our team debriefs from one of these lunch and learns, we're like, we have the coolest participants. You guys are the best. So thank you so much, everyone, for participating and sharing your insights. We have a short evaluation survey. We'll get a link to that in the chat. We ask that you please take a couple minutes to complete that survey. And then there's that link there. And I will hand it back over to Charisse to close us out. Thank you so much, everyone.
Yeah, thanks everyone for sharing your expertise and your lived experiences. We really do value your input to improve how we create these shared learning experiences. So please take the next 2 minutes. I'm going to stop sharing my screen and I'm going to put on some evaluation music for about 2 minutes, 1 to 2 minutes, and then we will close out this session. Okay, thank you for filling out the evaluation. Just a couple more slides left. If you have any questions, feel free to reach out to us at feedback@ccphealth.org. Check out our website, ccphealth.org, and check us out on social media. And last thing is we have 2 more Lunch and Learn events, one in December and one in January 2024. The next one in December is on sustaining partnerships, and the one in January is on qualitative research 101 and how it can be used in community engaged research. So again, thank you so much for your time and your participation, and we hope you have a lovely day. Thank you all for coming.